what I usually do with my process is I look at my last note, I look at the assessment plan. If I put in any consults for colonoscopy or any referrals, I make sure that the patient completed it. And then I just look at an interval history, what services between my last visit and the present visit, if they had any admissions, any consults completed and that type of thing. And that way it can be all put on my pre-planning sheet, so when the patient comes in that day, I can pretty much get the note done at the same time as I'm seeing them, because it's all written out for me, because we do it during the pre-planning visit. So, are we ready?
We're ready. Okay, so today we are pre-planning for December 11th. Your 8 o'clock is Mr. Cavallo. Records were requested. His BMI was 30.46. He was seen by nutrition in 2015. I was wondering if you want to make a follow-up appointment with them.
Yeah, you can try getting him in the same day as he sees me.
Okay.
So he doesn't have to make a separate trip.
He declined to move at his last visit, so I don't think he'd be willing to do that. He was seen by dermatology on June 30th for a superficial skin cancer, and it was treated with Efidex.
Okay.
Mr. M, 8799. He's 44 years old, here for a 6-month follow-up. He also had a high BMI of 36.99. So I was wondering if you wanted to refer him to nutrition or move.
Yes.
Which one would you rather?
Well, we can see
Okay.
about scheduling a nutrition appointment the same day, and then we can talk to him about doing move when he comes in.
Okay.
Let me just...
So he has back pain. So he was referred to the non-VA chiropractor, and he's using a TENS unit and gabapentin. You called him previously, and he felt this was working well. He's seeing allergy clinic for injections. He saw GI on June 17th for GERD and rectal bleeding. He had an EGD and colonoscopy on September 5th, and he had H. pylori and a tubular adenoma and polyps, and he was told to repeat in 5 years. I called him for his Hep C, and he declined, and he's seeing mental health for PTSD.
Okay, and his labs are all set.
And that's ordered, yep. So
Okay.
Mr. P, 9312, he's 86. His CAN score is 95. So he is shared care, so maybe when we see him we can educate him that he can come see us rather than go to urgent care. He's a 6-month follow-up. Shared care with Dr. Signorella, which his records were requested. His labs were ordered. He's being treated for bladder cancer on the outside. His last visit, his creatinine was elevated. You called him and he declined to see VA renal, so he went to see an outside specialist.
Mm-hmm.
I called him and he didn't pick up. I'm just awaiting to get the outside provider info so we can get the records for that.
Yeah, I definitely want to see the renal notes from him. Okay. And labs. Looks like labs are all set. Okay.
Mr. P, 0601, 72. He's a 6-month follow-up. He, again, has a CAN score of 95, so if we can educate him on coming to see us instead of going to urgent care. He had a lung nodule, so in your last note you wrote that he's due for surveillance in March of 2018. Do you want to put in the lung cancer screening consult?
Yeah, let me put that in right now.
He's followed by optometry for ocular hypertension, and he came in August for a sick visit. He was seen for numbness and weakness in his right lower extremities, and he was referred to neuro, and they did an EMG and MRI.
And he also saw neuro. Okay. And he's supposed to be seeing the seizure clinic, so we need to make sure he has a follow-up. Well, they canceled his appointment November 15th, so he's gonna need a follow-up seizure clinic.
Okay.
And actually, his colorectal cancer screening is up, so he's gonna need a fit test.
I think the seizure appointment was canceled because he saw Dr. Domingo Horn on November 3rd.
Yes, but that was for his brain tumor, not his seizures. And they wanted, in that note, they said they wanted seizure clinic to take over. The other thing is we put him in for bone density and he didn't schedule it, so we need to see about getting that scheduled. Okay?
All right.
All right?
And that's it for December 11th. So, so while we were pre-planning, anything that Deborah was saying that needed to be added to the pre-planning sheet, I was documenting on my sheet, and then after I'll go and update it. Kim was marking off any patients where the labs were ordered, she was highlighting them, so then after she'll call all the patients and remind them to do their labs 7 to 10 days prior to the visit. And Yen was following and opening up all of the patients in the computer, and then if Deb asked for any additional labs or cancellations or to add any consults, she was putting them in during the